NCLEX RN trainer with NCLEX RN tips. In this video, I am going to give you a case, or I'll describe a case. You can listen that and answer my question. Clear? Okay. You are working as a registered nurse in a pediatric unit where you got a patient or you got a child with suspected symptoms of renal problems and posted for renal biopsy. So here is my first question. What is the position that can be given for renal biopsy? Okay, so what is the position for renal biopsy? That is my first question, right? Fine. So where is the kidney situated? It is on the posterior abdominal cavity or posterior peritoneal cavity on the flank region. There are two kidneys. Okay. So what position you will give? You can give either lateral position where the affected kidney will be kept up, or else you can provide a prone position where a pillow can be kept on the tummy. So you have to read the options carefully and then according to that you have to select the answer. There are two answers. One, it can be prone with a pillow kept on the tummy so that the posterior peritoneal cavity will be just bulged up. Fine. Otherwise, lateral position can also be given. So this is my first question. Okay. Listen, second question. What position you will give post renal biopsy? What position you will give after renal biopsy? That is my second question. Answer my question. Yes. Post renal biopsy, the better position is supine. Okay, where you just made an incision over the flank region. Immediately after the procedure, you have to just apply a pressure over that area so that bleeding can be prevented. So, after renal biopsy, you can provide same side position, that means supine position. Clear? So, we discussed what is the position for renal biopsy, what is the position post renal biopsy. Two questions. Number 3. So, what is the third question? What assessment is required before renal biopsy? Before renal biopsy, what are the assessment that you should do? Number 1, you have to monitor vital signs. Basically, BP. If BP is elevated, you are not supposed to perform that procedure right now. Fine. And coagulation studies. Why coagulation studies are required? Basically, in case of renal problem, most probably platelet will be in the lower side, so it can precipitate bleeding. And if you suspect that, or if you notice that coagulation studies are in abnormal limit, again the procedure cannot be done right now. Fine? So vital signs, you have to check the coagulation studies. Since it is an invasive procedure, all other assessment, routine assessment as well as interventions are required. So I have specifically mentioned what assessment is required: vital parameter assessment, and second thing is coagulation study. And number 3, you have to assess the knowledge regarding the procedure. Initially I said the setting is in the pediatric ward. Based on the age of this child, you can assess the knowledge level. If the child is very small, then the entire explanation to be given to the parent. But if the child is okay to understand, you can assess the knowledge of the child as well. Clear? And last, number 4. Find what is the nursing interventions that is performed after the procedure. After renal biopsy, what interventions are necessary? Okay, so tell me what interventions are necessary after renal biopsy. Number 1, position, already we said. Number 2, assess for bleeding. Fine. There may be chances to get bleeding. Most probably it may not be there at the incision site, but it can be extracted in the urine. So you have to closely observe the color of the urine. Where the color of the urine is red, it is indicating bleeding. And every day, every time, you have to check the color of the urine. Usually, as the time advances, the color of the urine has to reduce. Suppose if after the procedure, if the color again as per the time advances, still the color increases. It is indicating that some bleeding right now it is happening inside. So you have to find out that. Fine. So immediately after the procedure, you have to monitor signs of bleeding. Vital signs, again assessing vital signs is pretty good. It is important. Fine. And then you have to provide a rest for the patient. Patients are not supposed to stand for a long time, and the patient can take a rest. Okay. And most probably weightlifting kind of exercise and strenuous activities can be suspended for 2 weeks. Why? When the patient is standing straight, the pressure, more pressure is pushed or it is given to the flank area. It can worsen the kidney's function, or it gives more pressure to the kidney. Already the kidney had a prick, right? So the injury get damaged, or more the injury get worsened more and more. Fine. So after the procedure, complete bed rest doesn't require, but strenuous activities can be suspended for at least 2 weeks. Fine. So I have discussed the four questions based on single situation. So nowadays in NCLEX RN exam, we get case studies. So these kind of learning will always help you to understand how to answer this kind of case study questions. For one case study, we get minimum 6 questions, but now in this video, I have only explained 4 questions. In the coming video, we'll explain more and more. Thank you for watching. God bless you all. Thank you. Stay blessed.